Reliability in an adolescent diagnosis by taking X-ray and physical examination, ultrasound, X-ray, colonoscopy, laparoscopy if needed in because the vertical CBC, hemoglobin, electrolyte, and creatinine coagulation studies, cystic plate coagulation panel, liver function test, occult blood test, Oxygen diary, sigmoidoscopy, colonoscopy, cause and distinguishing characteristic of GI bleeding, age, ingesting muscular blood, hematemesis, rectal large, electricity test indicate other hemoglobin is present, correct maternal flows, peptic disease, hematemesis, amount varies, blood found. In some people on lavage, as coagulopathy, hematemesis, or vector breaching other sites, and history of home birth, no vitamin K. Allergic colitis, threat of bloody mucus in stool, eosinophilus, infections, and in return goes on necrotizing. Enterocolitis, vector sick infant with tender and distended abdomen. Over 2 years old, hepatic disease, usually hematonesis, rectal possible epigastric pain, coffee road MS, asphasia viruses, hematonesis, serial evidence, liver disease, and seat injury usually has optomesis, rectal possible epigastric pain, coffee ground MS, inflammatory bowel disease, usually rectal crampy pain, poor skin, diarrhea, bacterial enteritis, rectal blood, diarrhea, fever, juvenile pollen, rectal pink display, red, flush in stool, not tested, McCall's, pivotal, rectal, messy, bright red, or maroon blood, no K, bowel vein syndrome, hematomesis, bright red, or coffee ground follows retching, hemolysis, uremic syndrome, rectal, thrombocytopenia, anemia, uremia, henbang, surely, leperitis, arthritis, colitis, hemorrhoids, rectal dilated external veins, blood whipping, and lower gastrointestinal bleeding in adolescent years concerns and require systemic approach to diagnosis. The diagnostic process aims to identify the source of bleeding, which can range from benign to life-threatening condition. Here is an overview of the steps and diagnostic tools to use. Clinical evaluation, medical history assess for symptoms like abdominal pain, diarrhea, weight loss, and changes in bowel habits. Inquire about family history of disease, medication use, essays, anticoagulation, and dietary habits. Physical examination for signs to assess for shock or anemia, tachycardia, hypertension, abdominal examination for tenderness or masses, rectal examination for occult blood, and inspection for honor fissure or hemorrhoids. Laboratory tests, complete blood count, CBC to check for anemia or signs of infection, coagulation profile, including PT, INR, and ABTT, especially if the patient is on anticoagulation therapy or there's a suspicion of anticoagulopathy. Type and cross-match, if significant blood loss is suspected or transfusion is anticipated. Blood chemistry, including renal function tests and electrolyte tests for dehydration or renal impairment. Liver function tests can be indicative of liver disease contributing to coagulopathy. Stool studies for occult blood, pathogens or inflammatory markers in cases of suspected infectious or inflammatory causes. Imaging studies, abdominal ultrasound, useful for evaluating the liver, spleen, and other abdominal events for conditions that might contribute to bleeding. CT scan of the abdomen and pelvis with contrast can identify areas of active bleeding, inflammation, and other abnormalities. And endoscopic procedure, colonoscopy, the gold standard for visualizing the lower GI tract to identify source of bleeding, such as colitis, polyps, or colorectal cancer, and flexible sigmoidoscopy can be considered if the bleeding is suspected to originate from the distal colon and rectum. Specialized tests, McCare skin, if Matthews diverticulum is suspected, especially in younger adolescents, coccygeal endoscopy for small intestine evaluation of tests are conclusive, and small bowel bleeding is suspected. Angiography used in cases of significant ongoing blood bleeding when endoscopic intervention might be needed, or to localize the bleeding site for potential embolization. Differential diagnosis consideration. Inflammatory bowel disease, IBD such as Crohn's disease or ulcerative colitis presenting with chronic diarrhea, weight loss, and abdominal pain. Infectious colitis, considered in context of receptor antibody use or exposure to infectious agent. Anorectal disorder, including fissures, hemorrhoids, or abscesses, colon and colorectal cancer to less common in adolescents. Familial syndrome can increase the risk. Bacchius diverticulum, a congenital condition that can cause painless bleeding more common in younger children but considered in adolescents. High-yield boys, a thorough history and physical examination are crucial for steps in evaluating lower GI bleeding in adolescents, guiding further diagnostic strategies. Colonoscopy is central to the diagnosis, allowing for direct visualization, biopsy, and sometimes therapeutic intervention. Consider age-appropriate differential diagnosis, keeping in mind both common and rare causes in this population. Only consultation with a gastroenterologist is advisable for a tailored diagnostic approach and management plan. So, lower GI bleeding in adolescent diagnostic. By taking history, physical examination, ultrasound, X-ray, colonoscopy, laparoscopy, if needed in markers for biological homicide, CMO, globin electrolyte BUM, reactive coagulation study, CC, and platelet count coagulation panel, liver function test, ocular test, observable, PRE, sigmoidoscopy, colonoscopy, ingested maternal blood, peptic disease, coagulopathy, allergen colitis, necrotizing enterocolitis, offers 2-year-old peptic disease, esophageal ulcers, anti-injury inflammatory bowel disease, bacterial enteritis, juvenile colic, and because the particular mallory-based syndrome, hemolytic uremic syndrome, hallucination, labor, hemorrhoids. Clinical evaluation, medical history, physical examination, complete blood count, coagulation profile, type and cross-light, red blood chemistry, liver function tests, stool studies, as abdominal ultrasound, CT scan of abdomen and pelvis, colonoscopy, flexible sigmoidoscopy, Wikia scan, capsule endoscopy, angiography, and inflammatory bowel disease, infectious colitis, colorectal disorder, colorectal cancer, metastatic surgery, and physical examination, colonoscopy is central to diagnosis. Consider age appropriate differential diagnosis or consultation with a gastroenterologist. Okay.